my mom and my sister actually have been given the gift of big breasts, so I've always wanted it when I was about the time of puberty hit, and then I kind of waited for them to develop, and since they never did, I actually took action as of this year. I went from an A34 to a double D34. I'm not shy about it. It's always something that I wanted. If you're not comfortable in your skin, I'm not saying don't love yourself. I'm saying, like, do something that makes you happy.
Our statistics are that, for example, last year in the clinic, we did about 1,200 cosmetic surgery operations, and 40% of our patients are below the age of 30. Younger patients aren't looking for restorative surgery, they're looking for type change surgery. And type change surgery says, you know, look at me, this is how I look. I don't like it. I've never looked any other way, but I want to be a different type of person.
People's bodies are rapidly growing and changing significantly between the ages of 10 and 18 or even 20. And so it's a particularly bad time to get plastic surgery because you don't know what changes are going to come after that anyway.
Occasionally you might do a rhinoplasty on, nose surgery on a 16-year-old if they come with their parents. You want to make sure that, there's physical and psychological reasons. You want to make sure that a person is fully grown before operating on a part of the body because you don't want the body to change. And you want to make sure that they're emotionally stable. So those are kind of the reasons that we wait until they're a little bit older. I don't think there's an age that's too young to have surgery. I think everything has to be put into context.
I think the younger somebody is, the more gullible they are, and the more they believe that what they see on television, on their computers, is actually real. And so they are more likely to want to look like a celebrity. And also they're at a point in their lives when it's very important to them to be, normal, in quotes, to look like other people their age, to not stick out. Young people are getting a message from society, from our culture, that that you're not right if you don't look exactly like some standard, that there's something really wrong with you as a person, and that's something that should be fixed.
I think everyone should be happy with how they look. But what do you do if you're not happy with how you look? That's really the question. So if you have a great big bump on your nose and you don't like it, I could tell you to like it as much as you want, but it's not going to change. You're not going to like it. And it's not, plastic surgery has come so far that the operations to fix those things are really safe and really successful. So in the future, I think that there will be more people having plastic surgery as it becomes more available and as it becomes safer. I think more young people will have plastic surgery, but only so far as more everybody's going to have plastic surgery.
Just make sure that it's something that you'd like. It's not something that you want to jump into. For my own personal experience, this is something I wanted since grade 9, and now I'm 25 years old, and I just got it this year. After thinking about it, after doing research and putting some time into it, if that's something you'd like to do, then go for it.